that each and every one of you put into making this moment possible. This is a real privilege for me to have 4 bills that I will formally sign today, but a package of other bills that many of you on the screen are responsible for getting down to this desk. It's interesting, this desk, I'm sitting at Earl Warren's desk, Chief Justice Earl Warren's desk, not Governor Earl Warren's desk. We were able to get this out of the archives and at a perilous moment when we think in terms of Supreme Court nominees to look back at a nominee that made history in no small part on this desk. While it's imprudent for me to compare and contrast the history we're making today on the issue of brain health and substance abuse, I do want to just acknowledge that we are at least beginning the process to make some history and to make some long overdue changes in this space. We have a number of champions that are here with us, and it would be imprudent of me not to acknowledge perhaps one of the most formidable champions, and that is our mayor here in Sacramento, Darrell Steinberg, who really launched a nationwide crusade at scale with many of you as advocates working in front of him, next to him, and behind him to push forward that landmark initiative that has provided us abundance, not abundance, but a profoundly significant amount of resource that has allowed us to be able to navigate the whitewaters of national funding declines and lack of support more broadly in the behavioral health space. So Darrell, I just want to acknowledge your extraordinary work and thank you for your champion many of these bills as well, and lighting up my cell phone 24/7 to make sure that none of these we're going to go awry and we're going to navigate this. I also want to just thank the 4 authors of legislation that are with us, and you'll hear from them in just a moment. And Senator Beall, who kicked things off, Senator Weiner, and Assembly members Quirk-Silva, and of course, Eggman. I want to thank all of you for your steadfastness, your stubbornness, your support. And I say stubbornness in a very enlightened way, meaning your willingness not to give up on some of these legislative efforts. I know some of these have been efforts in the past that didn't materialize and for whatever reason fell short. Some of these are not necessarily everything you wanted, and I get that as well. But I want to just thank you for all of your leadership and stewardship. These are good bills. These are bills we should be proud of. These are bills that move the agenda forward. Dr. Galley, came on board as our cabinet secretary, primarily because of his commitment to brain health and substance abuse. We had hoped this year to launch that significant transformation effort called CalAIM. COVID got in the way, but as Father Cause taught me at Santa Clara, God's delays will not be God's denials. We will prevail. We will get there. And I'm looking forward to next year and the year after that. We're going to keep coming back at this issue. We are committed. We are resolved to improving our behavioral health care delivery in the state of California and the integration of payments, the integration strategies that all of you on this screen are committed to as well. But I want to thank the authors as I move into these 4 specific bills for creating a platform, some momentum moving into the next year, talking about peer support, the profound importance of peer support. Senator Beall will talk more about that. This is an important bill, an important part of Senator Beall's legacy as he's been a ferocious champion on the issues of behavioral health for years and years and years, expecting more, demanding more from all of us. And Senator, you'll be missed in that space, but your impact is profound. And I just want you to know it's impacted all of us, and it's like a flywheel. I think we're starting to turn that wheel, and it's just going to create a lot of momentum as we move into the new year. And so know that your voice will still be very resonant, regardless of what capacity you have after your formal role here ends. It will continue to be very resonant in the work that all of us are responsible to do. And so I just want to personally express that. I also want to just express, as we sort of tee everything up, a deep appreciation for these other bills in terms of recognizing the opportunity to deal with some of the controversial aspects of Laura's Law in a way that I think sort of march forward where we're coming together. I get that Laura's Law. I live this as a county supervisor, not just as a mayor, as a lieutenant governor. We don't need to debate the merits or demerits, but this opportunity now, at least of other counties, to be able to wisely invest time and energy in this space is now made available because of a bill we'll be able to sign opting out, not necessarily just opting in. I just want to acknowledge some of the progress in that space. The opportunity to blend supports in the substance abuse and the brain health side with EMSA, that's a big deal, guys. And I just want to thank the authors for their work in this space. I'm really excited to sign that bill. I think it's going to make a big, big difference. And it's a big part of where we want to take CalAIM. And so this is an exciting, I don't know, I'm just excited to sign this today. And also, what else do we have? I'm forgetting all these damn bills. Which one? Parity. My God. How can we not talk about parity? Sal, you almost came through the screen, outraged that I didn't start with parity. And this is the beginning of parity, not the end, says Will Lightbourne and Galley and the team. And we recognize responsibility in this space. We talked about it in the budget. This is a big deal to move in this direction. Not everyone's happy with us, guys. Let's be honest about that. I got a lot of folks that wanted to pull the plug on this Zoom call today. But we're doing it because we're zooming into the future on parity. And this is long overdue. So thank you guys as well for your support in this area. So anyway, I'm not being very eloquent. And there are 4 people that will speak, or 5 that will be a hell of a lot more eloquent. But I am I'm very honored to be governor signing these bills today. And again, I just want everybody to know this is the beginning. We are committed, not interested, to advance the cause that unites us here today. I said that when I campaigned. We made progress last year. We're making a little more progress this year, and we're going to make big progress next year. Mark my word. But this is a really important step. And so, no further ado, one of our great champions on behavioral health, one of the biggest champions in this country. That's not an exaggeration on behavioral health, Senator Jim Beall. Senator.
Thank you, Governor, and thank everybody for all the hard work we're all going to be doing now in the future on mental health issues. And I think you're right, it is a process that we will move into. The pandemic has really changed the public's view on this. We now have a pandemic of despair going on through all elements of society all over the United States and in the country. I hope that our bill, SB 803, to bring peer support programs will help, and it is an important bill. It will expand and diversify California's behavioral health workforce, and it adds a proven mental health resources when we need it most, brings down millions of federal dollars during a tough economic time that we need to look at every dollar we can find to help people. I want to thank the sponsors of the bill, the California Association of Mental Health peer-run organizations, Behavioral Health Directors Association, County of Los Angeles, especially Dr. Sharon, and the Steinberg Institute, especially Darrell. And I especially want to thank you, Governor. The parity bill and this bill were vetoed twice. This is the 3rd time these bills have come before a governor. I'm glad you're signing them. Thank you so much for having the heart and understanding that we need from a governor on mental health issues. And I know you'll do much in the future for mental health. Thank you for signing these bills. Thank you. I'll turn it over to, I believe, Assemblymember Eggman.
Thank you. Thank you. All right, there we go. All right. Thank you, Senator Beall. And thank you, Governor, for signing the bill and for all the advocates who are here together. So I'm very pleased today the governor signing AB 1976, which is going to hopefully really push out outpatient treatment in a much bigger way. We've seen the epidemic, as Senator talked about. I liken it to our forest sometimes with our mental health issues. We didn't do anything for a long time, like with our forest, and then we've learned that we have to get somewhere into the middle. So we're not having wildfires on our streets with our mental health folks who are just suffering, and everybody sees it. And it's a blight on all of our souls when we look around and we see people who clearly need help and who are on the streets. So this bill, and I'm a licensed clinical social worker and was a professor at Sac State when the Mayor, Senator Steinberg's landmark bill passed, and was part of how do you actually implement and training clinicians to go out and do the new kind of work that the Mental Health Services Act asked us to do. And so then on this side of now I get to make laws that I think even push us a little bit further and continue to improve it. So this law will have counties have to opt out versus opt in to Laura's law. So that's somebody who then will be mandated into outpatient treatment if they've had over 2 hospitalizations in the last 36 months and or committed acts of violence. We know it came about because of Laura Wilcox, who was killed some 20 years ago by a client. And so her parents have been long advocates for this. So we were also getting rid of the sunset and still will continue work on this really important issue. So we're working on the outpatient. We still need to work on our inpatient and our bed space, and we'll all be back for that. And I think parity will go a long way for that. So thank you for signing the bill. I'm excited that we're going to continue to make progress. And we know it's just the beginning, and we're going to need to keep going. And I can think nobody better to partner as we take on all issues that are difficult than my friend Scott Wiener, who will be speaking next from San Francisco.
Thank you, Assemblymember Eggman. Thank you for your leadership. I want to second the governor's praise for my friend and my colleague, Senator Jim Beall. Senator Beall has been truly, in many ways, the leader on mental health for a long time in the legislature, especially after Darrell Steinberg left, one champion to another. Senator Beall convenes our mental health caucus. It's something that he understands in his bones, and he doesn't talk about it a lot. But when there are people in the Capitol community who are struggling with mental health issues, Jim will sit down with them and help them. So he doesn't just do it on a policy level. It is just a passion for him. So Jim, thank you so much. You've been a mentor to me on mental health issues. It's going to take a group of us to pick up the mantle now that you're termed out, and we're so sad to lose you, but we know you're going to continue your work. So thank you. And Governor, thank you for doing this in a way to really accentuate the need for improved mental health and addiction treatment. You were a champion and a leader on healthcare in San Francisco when you played a key role in creating Healthy San Francisco. And now you're at it again. And I know there's more that you will do, and we'll take this to a national level. Senate Bill 855, and thank you so much for signing it. And I want to thank the Steinberg Institute and the Kennedy Forum for sponsoring it, and the National Union of Healthcare Workers in San Francisco for really going to the mat and understanding the frontline impacts at Kaiser and elsewhere when we don't have mental health parity, and when people who need support for their mental health or addiction issues are denied that care and are told it's too early. You can't have your mental health or addiction care now because you're not sick enough. We'll treat you and we'll cover it when you have to go to the psych ER. And that's what's happening right now. Even when a physician or says this person needs mental health or addiction support now, while they still have a job, while they still have a home, while they still have their family, while we can still really help them, it's too soon. We'll cover you when you're already in crisis. We would never tolerate that for physical health. If someone has stage 1 cancer, we would never tolerate an insurance company saying, it's too soon. Come back and see us when you're at stage 4 cancer, then we'll provide coverage. We would laugh that insurance company out of the room. And yet that is what we have tolerated in this state and in this country for far too long, because we have somehow classified mental health and addiction as somehow different than physical health. It's not. It's all physical health, and we need to treat it the same. And what SB 855 will do is say that if a physician or if a healthcare professional says that your mental health and addiction situation means that this treatment is medically necessary, that the insurance company can't second guess that and tell you to wait until you're in crisis. This law will dramatically expand access to mental health and addiction care in California. It will put California in the forefront in mental health parity and set an example for other states. And I am so excited, Governor, that you're signing it today. Thank you for that, and thank you for your leadership.
Thank you, sir. There you are. Hey, Sharon.
Good morning, everybody. I'm Assemblymember Sharon Quirk-Silva from Orange County, and I'm thrilled to not only have the honor of the governor signing AB 2265, but also to be here with colleagues who have shown such determination and partners who spend their life's work working on issues that surround mental health. My bill is a bill that basically sometimes you hear a little small change, but it's a significant change in the sense that it brings clarity to existing law to allow mental health providers and counties to be able to see patients with co-occurring mental health issues. And not all, but many patients not only have mental health issues, but also suffer from addiction and sometimes even chronic health issues in addition. So it's not just co-occurring, but it can be even more than two. I just want to bring it to the person level and say this bill is very personal to me. As 2011, as I sat in the Fullerton City Council, a schizophrenic man was killed in Fullerton by 6 police officers. And it was kind of a breaking case that went nationwide. That was in 2011. 2 years ago, almost to this month, my brother, who suffered from not only mental health, but addiction issues, also died. And then just a few days ago here in San Clemente, another homeless man was killed by police officers in the sheriff's department. These are happening all too often. We know that there's multiple reasons and things that have to be done, whether it's training for officers, but we also know that all of us see too often people on the streets and corners throughout the state of California. And it's become a moral imperative that we do not walk by, that we look at them, we see them, and we get to work to help them. So I thank you, Governor, for signing this bill. And as my Senator colleague, Scott Wiener, just said, we must treat mental health issues the same way we treat physical issues. As was said, if somebody has cancer, let's get them in. If somebody has a mental health issue, it's kind of shh, don't talk about it. And we need to talk about it, and we have to address it. Thank you again to my colleagues and to Governor Gavin Newsom.
Monica, you're with us. Want to say a few words? And Monica, by the way, Monica, yeah, there you are, the mute, but tell us where you are.
Okay, I am in Pacoima, California, and I'm working in a pharmacy, helping people that unfortunately are sick and maybe suffering from COVID. So working right now, but that's my job. I'm a pharmacist. But the reason I'm here is because it's so passionate, personal to me. My son 10 years ago went innocently enough to go get his wisdom teeth extracted. And at that time, the dentist prescribed a pain medication, which is understandable, but a large amount of opiates. At that time, he became addicted. And little did I know what our life would be turned upside down. And again, I'm a pharmacist, so how ironic is it that my kid gets addicted to prescription pain medication, but that's what happened. And was I ready for it? No, I took my pharmacist cap off, and now I put on my parent cap, and I had to deal with all of this. And the one thing I thought I could depend on was the insurance, because, you know, after all, that's what it's there for. You know, I work, I pay for my insurance, and, you know, how is it that every time I'd hit like a roadblock and saying it's not covered, or as one of the speakers prior said, he's not to the point that we have to actually put him in residential. And if those that know about addiction, you have a small window of time where when that individual is ready to go to treatment, you got to jump on that, and you can't wait for it. And that's sort of what happened. You know, 10 years my son has suffered with addiction. A lot of it could have been avoided if we got the proper treatment quicker, more aggressively. And just like one of the other speakers said, you know, I fight for my kid. There is a stigma associated with addiction, with substance abuse, with mental health, all of the above. And did I ever think this would happen to me? Never. But I, at this point, have fought so hard, and I was lucky to be in the medical system that I was able to navigate through the insurances and not allow a no. I would fight and say, no, he needed to be in there, and they'd send him home, and sure enough, he'd relapse, and sometimes he was on life support. And I saw a boy at 15 be so full of life turn into a drug addict. And how could we avoid that? How can we intervene with that? How can we prevent that? And that's me now being a mom and a warrior, that I will fight for my kid. And I am proud to say we are one of the lucky ones. We are one of the lucky ones that my son is alive, and he is thriving. And he had to go outside of my insurance to go into a public insurance in order to get himself into a treatment program that didn't have so many boxes that he didn't fit into. So he eventually got the treatment he needed. So luckily I can say my son is sober now. He is back in school, and he is finishing where he left off at. And I'm very proud of him. Governor Newsom, I want to say thank you so much for having this bill on your table. And I want to say thank you so much for supporting it. So at this time, Governor Newsom, I would like to ask you to please sign the bill.
God bless. And Monica, as a father of four, it's thank you for putting all this in perspective, and thank you for being a great mom and believing in your kid. And I'd be remiss because I'm so proud of him, and he's a good friend. Darrell, you want to just say a few words, because I know how important these bills are as well to you, before I answer Monica's question.
Well, thank you. I don't want to delay the signing any longer, Governor, but I appreciate the honor and the opportunity. And to Monica and to Sharon, these bills are about your family members and the thousands of people who suffer needlessly, who don't have to suffer. And I want to thank all of you. I want to thank Assemblymember Quirk-Silva, Senator Beall. Yes, your legacy is embedded and will never be forgotten. Senator Weiner, thank you for becoming a champion. Assemblymember Eggman, the same. I also would be remiss briefly, Governor, if I did not thank Nick and Amanda Wilcox, the Kennedy Forum, John Sharon, on the Peer Bill, the Steinberg Institute, I know it's in my name, but my incredible team of Maggie Merritt, Barbara Liebert and Julie Snyder, Sal Roselli, Sally Zinman, all the other advocates. Governor, you gave a State of the State address that was focused largely on mental health. It was historic, actually, because no one had done that before. Despite the pandemic, you and the legislative branch of government have stayed with it, and today you are signing, in my view, the biggest advance is that we have seen in at least a decade in mental health. And that is a big deal, especially given the times that we have been living through. Mental health has been the unaddressed issue of our time, but I will tell you the progress. 10 years ago, very few legislators would introduce bills on these subjects, and a governor would never have a signing ceremony on this subject. 10 years, represents real change. Very briefly, I'm sorry, on the bills themselves, because it is noteworthy. On the peer bill, I authored this bill 10 years ago, and yes, it was vetoed by numerous governors. You've changed the mold here, man. There is nothing more powerful than someone with lived experience helping someone else in crisis. This is going to make a huge difference. On the parity bill, again, briefly, we spend so much time focused on the public side, on the Mental Health Services Act, rightfully so. Accountability is important. But you know, parity is every bit as important, if not more important, because they've got to cover what the public side is covering, all the innovation, the prevention and early intervention, the wraparound services, obviously substance abuse and eating disorders. This will make for an integrated and whole mental health system, as you aim to do through CalAIM, which I know you will get to. And so I'm just really proud to see what is happening in California in real time. Our day has come around mental health because we have legislators who care, and we have a governor who has chosen to champion this issue. Very, very grateful. Thank you.
Thank you, Mayor. Again, thanks for all your extraordinary leadership, and thanks for all those generous words about so many of the folks that are assembled here today, and those that couldn't join us. By the way, I want to acknowledge Tom Inzel for all of his hard work and advocacy, and Mary Watanabe, thank you as well for all your good work that is deeply recognized, and it's as I say, wonderful to have Dr. Galley with us, because his commitment to this is very, very real, and will be felt over the next few years. So with that, let me just jump right in, and Monica, I will. The answer is yes, happily sign these bills.
Thank you.
I didn't want to leave you, with that question unanswered, but Senator Beall, this is your bill, SB 803, and I'm honored to say it's now law of the state of California. So thank you, Senator, for everything you've done. Everything. What do we have up next? And this is Senator Weiner. This is SB 855. And we are honored as well.
Thank you, Governor.
With that law in California.
Thank you, Governor.
We have, Sharon, this is yours. Assemblymember Quirk-Silva, 2265, Assembly Bill.
Thank you so much.
Thank you for this.
Thank you.
And then 1976, Assemblyman Eggman, honored.
Thank you, Governor. Thank you.
Hey, this was really important day. Thank you, guys. And I don't know why I get emotional about this, but I'm really grateful to all of you guys. Thanks for leading. Thanks for making a difference. This is making a difference in real people's lives. God bless you all. Thank you.
God bless you.
Thank you, Governor. Thank you. Thank you, Governor. Thank you.